My early years in growing up, my father was a district manager for Safeway stores in Hyattsville, Maryland, and decided that he would be an entrepreneur and buy his own grocery business. So he bought a small independent grocery store. I was 13 years old, so I spent from 13 to 21 working at my father's family business. And a couple of lessons learned from that. One is I didn't want to be in the grocery business. It's a tough business. He worked 7 days a week, 12 hours a day. Kind of had a niche business in that he had great meats, great produce, and beer. And so he did really well. It was kind of Whole Foods of the 60s, if you will. So he did well, but he was open 7 days a week, 12 hours a day. And those of us who were in his family were obligated to be right there with him a lot of the time. So, didn't want to have a family business, didn't want to be in the grocery business especially. I mean, family dynamic is healthy, but when you get a little too close at work, it can get a little tense. So, went to college, went to Clemson, and became a civil engineer. I still hold a license in civil engineering, but anybody with any sense wouldn't let me design their chicken coop for them. I've been out of the engineering business for a long time. But had a great experience at Clemson. My draft number in 1971 was 7. So I was either get drafted into the Army, the Vietnam War was still going on, although winding down, or pick another branch of service and go to officer candidate school. And that's what I decided to do, went into the Navy. Seriously said, had a great experience at officer candidate school in Newport, Rhode Island. I spent 9 years in the military, up to the rank of lieutenant commander. Got out primarily because we had 2 children, and as we looked down the road at a career in the military, it's a tough one when you got to move your kids every couple of years. Lessons learned in the military, all about leadership. You know about clarity of vision, the importance of teamwork, how critical it is to know how to communicate, how to motivate. Small unit leadership is the core of the military. I think when you look at any business, it really is the core of successful business. Just getting managers to really understand their jobs and really execute well in terms of their responsibilities. One thing that did shape me significantly, too, in the military was in 1973, I went through a 1-day diversity training program. The Navy, the military at that time really did understand that culture was key and that diversity, embracing diversity, was also the key to success. Key to teamwork, key to understanding one another that resulted in an ability to move an entire brigade or battalion forward. So it was very impressive that at that time, in 73, they were doing that with naval officers enlisted. So, and just now, decades later, corporations, some of them are just now getting into that. So it really did shape me, impress me, and those lessons from the diversity training still live with me. I got out of the military, and the family and I moved to Memphis, Tennessee in 1980 and went to work for Exxon Corporation here at their regional headquarters, which ironically enough is the same building, or the building I occupy today was the site of the regional headquarters for Exxon back then. We'd been here about 9 months, and Exxon said, hey, we need to consolidate to Houston, so we're going to move you to Houston, Texas. Well, that wasn't exactly what we had in mind. We got out of the Navy because we were moving around, and here we go with Exxon. So we started looking around at jobs, and I found a job as a project engineer for the Med. The Med had just become the Med. It was the City of Memphis Hospital, and it was a hospital that was on the brink of failure, but Jim Round and others with a lot of wisdom developed a 501c3 that they thought would be more effective in running the city hospital. So it was an organization that was really beginning a transition, and an exciting one. So I really got on the ground floor of that in 1981. And about 4 years later, 1985, I was selected as the CEO at the ripe old age of 36. Yeah, that's something I probably wouldn't do even today as somebody who sits on a lot of boards. But the board had confidence in me, and they, I think they saw that I had a great relationship with the medical staff, and at the time that was really important. It's important at any time in a hospital's life. But as this new 501c3, we were going to take the organization and really make it successful financially, make it successful as an organization that really did great service for the community. So we developed the Trauma Center, we put a business plan together for the Burn Center, we developed Hospital Wing as part of the Trauma Center overview and spectrum of services. And I learned a tremendous amount when we finished that facility, opened it, and really tried to change the image of the organization. The key lesson from my years at the Med, though, was that with the right talent, you could accomplish anything. Dr. Tim Fabian at the Trauma Center was the reason the Trauma Center got developed, and the reason it's now one of the best trauma centers in the country. We hadn't given the support. Without that leadership, it wouldn't have happened. Bill Hickerson, who was with me when we started the Burn Center, left and is now back running the Burn Center. Another talented position, the absolute key to success for the Burn Center. And I can go on, but it is talent that makes the difference. Even if you don't have all the resources that we absolutely would love to have, that is the learning. Then Maurice Elliott called me up in 1991 and asked if I'd come to work for Methodist and be part of his team as he tried to take Methodist in a different direction. At the time, Methodist was a distant second from Baptist. They were formidable. They still are. They're a wonderful competitor. I have tremendous respect for Baptist and what they do. But at the time, we really were pretty low when it came to a lot of indicators that would tell you how effectively we were competing. And Maurice was determined to really move the organization ahead. So we established an East presence with the purchase of Germantown Hospital. We merged with Lavana in 1996. We had no relationship with the more prestigious groups in town, Sims Murphy, Campbell's. We established those. We now have a wonderful relationship with the West Clinic. It's so great to see the founder of that, Bill West, sitting here, and I'll come back to that in just a minute. We established the Mary Institute, a research institute. Probably one of the most significant things that happened in 2000 was that we started to develop a partnership with the University of Tennessee. When you look at the top 25 health systems in the country, all of them are academically owned or affiliated. The way to get the best talent, back to those med lessons, is through the academic affiliation. The best talent comes for research, they come for education, they obviously come for patient care. But the folks that you really want that are going to take you to the kind of clinical care that really does demonstrate excellence are those folks who are involved with the academic enterprise for the most part. There are exceptions to that without a doubt, but that is kind of fundamentally key to really taking an organization forward. So we have an overall aspirational goal being in the top 25 nationally. We aren't there in the adult world. We are there at Lavana. We just got ranked by U.S. News and World Report as 24th in the nation out of 220 hospitals. Again, that's talent that makes the difference. I mean, Mary Armour has done a great job. New facilities make the difference too, and I want to thank you all. The community, committed and invested $110 million in the new Lavana facility. It cost $360 million to build. And thanks to that, I mean, there are other contributing factors, but a new facility really attracts talent. So we've got 22 new physicians that come to Memphis from places as prestigious as Boston Children's, Cincinnati Children's. I mean, these are organizations in the top 5 in the nation. They're coming to Memphis because they see some things happening here that they can be a part of. The St. Jude connection also makes a big difference. It is a big appeal. So between between St. Jude and Bonner, we're developing really world-class medicine for pediatrics. It's something that I know all of you take a lot of pride in. So Methodist today is 11,500 associates. We're in 7 locations. We're building an Olive Branch Hospital that'll open up next summer, probably June or July. That'll give us a North Mississippi presence. And you may have just seen we're affiliating and more strongly tied now to the Crittenden Hospital over in West Memphis, Arkansas. We're at $104 billion in total revenue. So the learning at Methodist really is culture is the key. I mean, building the right culture, one that really does attract the talent, but also a culture that really has at its focus the patient experience. And we're all about that. We are building a culture around patient and family-centered care. We really believe that the family and patients are not just there to receive services, but are true partners in care. And it's that culture building that is, to me, the most important thing that we're working on right now. We have a great partner in doing that, and that's an organization called Send Delaney. They have been with us for about 2 years. Bill Rhodes at AutoZone put me and Mary Armour onto them. They work in a lot of the big Fortune 500 companies. They're now working at FedEx. FedEx has seen what's happening with them, and they have gotten in with Mike Glenn and Rob Carter and the group over there. So really game changers and some of the best tools I've ever seen. So what are the leadership lessons from all those years? I mean, leadership, you know, you talk about leadership. If you Google books and articles on leadership, you'll get about 55 to 70 million hits, depending on how you put it. I mean, that just tells you that this isn't an exact science. It's not a cookie-cutter approach to leadership. But there are some fundamental things that all of us experience and hold to be true. So one of them is that you really have to be persistent and results-driven. If you look at a lot of the articles on why CEOs fail or why leaders fail, it's typically because they confuse activity and busyness with results. And you really have to have that sense of prioritization and that ability to get results, get things done. It sounds so simple, but I just see so often people not getting the results and thinking that they're doing a great job. So you've just got to keep that in the forefront. A lot of CEOs who fail blame the environment, they blame the governance, they blame a lot of things. The bottom line is they didn't get the results. The competitors are all dealing with those things. They're all facing the same environment, the same issues, but the competitors are winning and they're not. So it's that focus on results. Secondly, and I think this is probably the most important attribute for anything, it's the one that trips the most up, and that's self-awareness. Constantly getting feedback on how you improve. It's a tough thing to hear sometimes, but we all recognize that we have opportunities for improvement. All of us have blind spots. All of us have areas where our skill set isn't quite there. So getting those opportunities for improvement are really important. So I talked about Send Delaney. One of the first things they do is come in and they work with your teams and they interview your teams and they get feedback from your teams, and your teams then, after that feedback, they consolidate it and they give it to you. And so one of the things to me that's been the most beneficial is that feedback, and I'll just read you a couple of things that came out of it and tell you how I use it personally. So one of them is, I need to contribute more to improving the decision making on the team. Once we decide on a path, stay the path. Let the organization know. Don't let people backdoor the decision by coming to you later after the group discussed it and decided on a direction, and minimize the rehashing of decisions. Secondly, hold members of the team accountable to implement decisions. There's a perception you allow people to operate in a way that's inconsistent with the stated direction. And lastly, well, this isn't last, it was the last one I'm going to give you. People have a sense that you're a nice guy, you avoid saying no at times when they think you should say no. There's a sense that making people happy is at times more important than making a tough decision. That was 2 years ago. I've taken that to heart. I've really tried to modify my behavior. I have a little card that I carry with me with various I will statements that address some of these behaviors that have been pointed out to me. So, self-awareness. Take it seriously. Take constructive criticism to heart and really try to modify your style and your leadership ability accordingly. It is, I believe, the most important thing you can work on. And lastly, is values-driven. Values-driven leaders are the most successful. You know, our values are integrity, quality, service, teamwork, innovation. As a leader, you've got to demonstrate your commitment to those values through your actions. I mean, what we do is more important than what we say. It really is. Warren Bennis is a management consultant that I read a lot. I think he has a lot of good common sense approaches to leadership. And here's a quote from him: "A leader doesn't just get the message across. A leader is the message." So, you know, keeping that in mind, I really tell all of my leaders, don't underestimate the fact that people watch everything you do, and it does matter. So those are the leadership lessons, the three that I wanted to highlight. Leadership is just so important for any organization and the future of any organization. It is particularly important in healthcare today because we're undergoing some pretty radical change, and a lot of challenges face us. It's a tough environment. So where are we headed? As an industry, we really are characterized by only incremental changes for decades. We've been slow to learn. If you look at our progress compared to banking or the airlines or the retail industry, we aren't nearly as progressive when it comes to convenience, safety, IT development, or even patient satisfaction. We're relatively reactive. We've been slow to shift from a hospital-centric or provider-centric world to more of a patient and family-centric world. We're generally have been centralized around a big hospital. That's not the future. It's been way too much on high technology, and on big cost facilities, and high levels of specialization, and not enough on what goes on outside of our footprint. And we've been siloed across the continuum, probably our biggest challenge. So you all experience this in healthcare. Whenever you have to utilize your doctor, or if you have a chronic illness or disease, you go to one specialist, and then you might be sent to a different location. Let's say you have lung cancer. You're sent to a different location for a CT or an MR. Then you're sent to a different location for radiation therapy. Then you might need, in addition to your medical oncologist, you might need a couple of other specialists where you've got to try to coordinate that and generally navigate that yourself. One of the things that Dr. West is involved with now is working with us on more of a service line approach to cancer. When you look at the MD Andersons and the ones who really do it right, theirs is a multidisciplinary team effort so that the patient is assisted by a team. There's a head of the team, but the care is coordinated. And right now, generally, care is poorly coordinated, and we've got to fix that. We know we have to fix it. So that's probably the number one thing. And because of the disjointed nature and somewhat of the fragmented nature of healthcare, we make too many mistakes. Just this week, the Commonwealth Fund came out with an article that just highlighted the U.S. trails other developed nations in preventable mortality. Despite all the resources we put into healthcare, we're behind. Johns Hopkins, the #1 hospital in the country, revealed again last week that as many as 40,000 critically ill adult patients die annually with undiagnosed medical conditions. About 28% of adults in ICU care die with undiagnosed medical conditions. And again, that's at Hopkins. And then, as an industry, our costs have been out of control. So we're now 18% of GDP. That continues to escalate. It is almost double any other developed nation, sometimes triple, depending on the developed nation you're looking at. $2.5 trillion. So what's happening here? We have the best trained doctors in the world. We have the best trained healthcare professionals. We have the best facilities. We have the best technology. Why do we have so much waste? What's really going on? It's a maddening paradox. Patients get either too much care or they get too little care, too frequent. Just this last week again, the Institute of Medicine, regarded in my world as an organization to pay attention to, said the U.S. health system wastes $750 billion every year. They highlight unnecessary services as $210 billion, administrative costs is $190 billion, inefficient delivery of care is another $130 billion. That's a remarkable opportunity. That really is. I mean, that's pretty staggering when you think about 2.5 trillion plus, and almost at least a quarter of that is an opportunity for improvement. So that's got to be our focus. The conclusion of that is we've got to change. We've got to reform ourselves. And that real reform is not going to be dictated out of D.C. It's going to come region by region, health system by health system, practice by practice. I mean, that's where it has to happen. That's where the expertise is. It's not sitting anywhere else. It's right here. And then we share those best practices as we develop. These are very uncertain times, and leadership in uncertain times requires a point of view. So I'm going to share with you some points of view. First, I'll share with you a quote by Jeff Immelt, the CEO of GE. He says, any executive or organization that wants to change things should be guided by a point of view about what's going on in the world, and you invest around that point of view. Develop the point of view and put your resources around that point of view. So here are some points of view on healthcare. First, our provider revenues will be under severe pressure as payment mechanisms migrate toward value-based purchasing and government sources of funds go down. So the typical health system, at least half of your money comes from Medicare or Medicaid, which is state or federal dollars. They, at best, are flat for the next 2 to 3 years. I think that's probably optimistic. They're probably going to go down. So that's half your business. The commercial business, most of the CEOs I talk to say it can't get above inflation anymore. You've got to quit this cost-shifting game of making up the losses for indigent care and the government patients on our backs. You're going to have to figure it out in a different way. You all would probably agree to that. Any of you who are paying health plan premiums for your employees. You don't want to pay more than 2 or 3% a year. You certainly don't want to pay 5 to 8, which is what a lot of you are facing, I know. So the reality there is we're probably facing net a 1% increase for the next 3 to 5 years at best as organizations. And our inflation is going to be 2 to 3%. So for our organization on $1.5 billion, we're looking at a $20 to $30 million gap every year that we've got to close. So we've got to get more efficient. There's no doubt about it. We've got to get efficient for all the reasons I've mentioned in terms of patient care and higher quality, better service delivery. But we certainly have a business imperative here to reform. So that's a point of view. Another one is we've got to have a new set of competencies. Really, as providers, yes, we need to deliver great service, but we better do some other things too. I had the opportunity to go around and interview over the last 2 months a lot of my CEO customers. So a lot of the larger organizations in town, and talk to them about what are your expectations from us as a provider. They're threefold in terms of their focus on healthcare. Number one, an affirmation that this is a boardroom issue. This is big money that we're talking about now, so this is important. Focus on wellness. And you're seeing that in every major employer. Bill's involved in that now. So everybody's saying we've got to have healthier workforce. And you as the healthcare professionals need to help us get there. It's interesting, in the 8 places I went to, nobody had the same approach. Everybody's trying to build it themselves. There's not a template anybody's able to take off the shelf and say, here's what we're going to put into place at AutoZone or at First Horizon. So there's an area of opportunity for us. Secondly, they're moving to health savings accounts. Put more of the burden for decision making and for selection and for payout on the employee. So $5,000 account is yours, and you can spend it any way you want. If your doctor tells you he needs an MRI, you better find out how much it costs, because you're going to write the check for it. So that's an important message for us in that price sensitivity suddenly, where it hadn't been much of a factor in terms of the consumer's eyes. It had been with the major employers that we sign contracts, but the consumers now are more and more in the game. And then lastly, they say, be innovative. Bring us some new ideas. You know, y'all are, again, you're the experts. Tell us how we can save money, how we can improve the quality of our employees' lives, their productivity, and their health status. So really get some things in front of us that we can use and we can implement. Well, that's a whole new core set of competencies for us. We got the message loud and clear, and we're working on it. So we are taking a lot of new approaches. One of them I'll just mention, and that's medical homes. We're trying to get primary care doctors to a point where they're incented to keep you healthy, and they're incented to do fewer things to you. So just one quick example, my CFO was visiting his primary doctor as part of this medical home model with Cigna, and he had a numb right arm, and the doctor said, you know, I think it's a pinched nerve, and I think we can treat it with steroids. And before the medical home model, I probably would have sent you to get an MRI. Well, let's try this out for 2 weeks and see what happens. About 2 weeks later, he's fine. Didn't need the MRI, saved $1,200. So that's just one small example of what could occur, though, if you get the incentives aligned and the provider mentality right. Lastly, I think we're going to see a lot of consolidation in the industry. We're seeing it now. You just can't, with all the fixed costs we have, you've got to achieve economies of scale. If the talent depth has got to be significant for any hospital to survive, especially. Physician practice the same way. It's why you're seeing a lot of practices come into the larger enterprise. And then the last point of view, and I'll take any questions if we have time, is that as a not-for-profit, and as any not-for-profit in the nation, we're going to be tested. We're going to be asked to prove our status as not-for-profit is worthwhile. So we've got to be more in community. We're trying to do that through our congregational health network, through a lot of the outreach efforts at LeBonner, through the work we're now doing at 38109, and through our academic enterprise. Giving back to the community is something that has to be core to a faith-based organization. It's got to be how we live, and again, how we act. The good news, reform's happening. As patients or potential patients and as community leaders, you're going to see remarkable change over the next 3 to 5 years. I think we're going to have better service. I think it's going to be more efficient, and it certainly is going to be higher quality. And you're going to be able to see all that because transparency is another fundamental key to success for the future. So right now on our website, if you go on it, click on About Us, look on the quality indicators, you can see all the good and the bad about Methodist LeBonner Healthcare in terms of quality indicators. Few people click on that, but I would encourage you to, because it is the future. So I'm optimistic about the future. A lot of this change is going to be very positive. A lot of this change is going to happen regardless of what happens in Washington in November. Not that that's not important, but frankly, in the scheme of things, what I've just mentioned is all going to be taking place, and the election will happen.